Assalamu alaikum. My name is Islam Qasem. I am oral maxillofacial surgeon. Today I'm going to start an interesting topic. It's about the lip aesthetic. I think this topic is highly important to every dentist practicing all over the world. Before I start, I have to declare I don't have any conflict of interest in these lectures, and there are no monetary benefits from these lectures. The photographed patient treated by me and consented for photography and public publishing, and this is very important issue. Actually, this lecture is dedicated to this person who invited me. Really, I appreciate his effort for scientific publications in our Arab area. I know him before 3 years, and I think he's one of the added value in my life. This photo, I get it from the Description de Gite. This is very famous book. It's published by these people. There are no limits of passion of ancient Egyptian of both colors and funny jokes, and I think our grandsons, they continue this passion. Okay, in this presentation I'm going to continue a very interesting I'm going to speak about the smile, the lip anatomy, the static lip and dynamic lip. I'm going to speak about how we can use a lip fillers and how we can use a static rejuvenation for the lips, and also how we can treat a gum smile. This is beside the colors, and this is very important issue. I borrowed this photo from my friend in American cosmetic dentistry. Why the patient came for us? This is very important issue. The patient came for us to improve the physical attractive and self-esteem, so very important for us to have a very good knowledge about the anatomy and about the beauty. Why the patient came for us? In this lecture I'm going to focus on the smile and how we can create a smile for our patients, and also the concept of facial beauty. Okay, this lecture, its aim of being different. This is very important issue. You have to be a different. This is very important. If you are different, you'll be like this fighter foot. It transferred from level to level. I asked this question to my colleagues: who is the most beautiful lady girl in the world? There are different answers based on your characters and based on a lot of factors. This is from our cultures. There are different lady, they are considered a beauty. By the science of the beauty, this is the most beautiful lady in the world. Her name is Susan McMurk. Why she's beautiful? We are going to see why she's beautiful. I think one of the key of the beauty is the measurement, secrets of measure. There are different way of this. First parameters, it's aesthetic subunits. We have uniform aesthetic subunits, either lips and nasolabial fold. This is very important for us when we are creating smile to our patient. Also, there are measurements, this described by Leonardo da Vinci. This is rule of thirds. It's very important for us when we are creating a smile. Another line, this is very important. We call this relaxing or Langer's line or line of relaxation. This is very important, and this is very important for us as a surgeon when you are putting our incisions. Also, these lines is very crucial for us. We follow these lines with laser when we make gingival depigmentations or lip depigmentation, or even when we use laser for facial rejuvenations. This video, it will show us. I encourage you to download this app. You can download it if you have App Store. It's measured the phi matrix, or what we call it golden ratio. It's used in a lot of things. We used in the face. This gives us a very good idea about how we can assess the beauty for our patient, and also if you are sharing in the beauty assessment, this is very important and help you dramatically to create a beauty for our patient. Actually, we can use a 16 different line to measure this for our patient, and this is help our patient. We can get the first line from interpupillary to the down of the lips, and also we can go down to the chin, and this is very important. The size of the lip act as a very important, very crucial element in the beauty. Also, we can measure the flare of the nose. This is very important, especially when you are going to treat a gum smile or short lip or large lip. This is very, very important for us. Also, lip size, the discrepancy between the upper and lower lip is very, very crucial for our patients. The total facial height is very, very crucial, especially the facial thirds, and the eye size. It's very important and give us the important indicators for the beauty of the face. Now there are an increase of facial aesthetics. Why? Because we have a social media and everybody have smartphones. So a lot of our patients, they ask for facial aesthetics and for dental aesthetics, and they are become more criticizing to their faces. Very important, you have to follow when you make a facial beauty, you have to follow this sexual dimorphism. This is very important when you are creating male smile. It's completely different than female smile. Actually, in male, you have the jaw, it's more broad, and the bottom, the lips is slightly smaller. This comparing with a female, and this is being attributed to the difference in the estrogen hormone. This photos, it's more from my country. Some beautiful faces from my country. Our faces didn't change so much. I give you some beautiful faces. I have hundreds of these faces. I like to photograph it. And I have some more recent. And I have one exactly like me, by the way. Very important issue, and we have to tackle this when we like to create a smile or something. We call this for our patient. We have to work an anti-aging regimen for our patient. So it's better to get a photo for the patient when the patient is young. I think it's very important to know that the facial aging for our patient. So let's see this video. It shows us the difference between aging in male and female. See, by aging there are what we call it marionette, and there are increasing in the philtrum regarding to the lip, and there are marked demarcation for the nasolabial fold. Regarding to the lady, we find a very, very important things. This is very important thing regarding to the lady. Regarding to the lady, there are demarcation between the lips and the skin is lost. And also there are so much thinning for the upper lip comparing with the lower lip. This video, it will show us the differential between the upper face and mid face and lower face. This is very, very important. Between the upper face and mid face. Aging, it appears in the bone, and it appears in soft tissue and also on the skin. Regarding to the eye, there are lowering for the eyebrow. This is beyond the scope of our lecture today. And also there are a tear trough. And this is what we call the crow feet or sunrise. And regarding to the forehead, we have this drooping of the eye drop, drooping of the eyebrow, and also what we call the thinker's line. Regarding to the mid face, and this is our topic for today, we have the protrusion, the beauty of the protrusion of the zygoma, it will decreased, and also there are decrease in the resorption of this fat. This fat is continuous and get the nasolabial fold become more prominent for the patients. And nasolabial fold give the patient very senile appearance for our patients. See, this is what we call a tear trough under the eye. And there are marked increase in the philtrum. We have very marked things. We call this marionette line. Marionette line, it's means that we have depressor angli oris. This muscle has a weakness. Plus there are a resorption in the fat. And there are increase in the philtrum. This is very, very important things. There are marked increase in this philtrum for the patients. There are loss of demarcation between the upper and lower fat and lower lip. And this is what we call jewel. This is from laxing of the mandibular ligaments. And also there are sagging for total the face. This is exactly what happened by aging. Let's see this cartoon. It will show us the very important. This is regarding to the soft tissue element of the face. If you saw this muscle, and this is a soft tissue of the face. So if we have to create a smile, or what we call an anti-aging program for the patient, we have to focus on this. This is very, very crucial for our patients. Okay, so if I have this regarding to dynamic static profile for the gum and for the face, I have to restore it. How can I restore it? The most easiest way, I can put something to fill this defect. The most common things, it's what we call it hyaluronic acid. It's types of saccharide. So we just inject this in the lips to restore the normal aesthetics. The sign of the aging in the lips, it's the blunting of the Cupid's bow. These beautiful Cupid's bow become blunt. And the blunting of the philtrum, column and philtrum, downward of the oral commissures, and equal heights of the upper and lower lips. Okay, and less of the extension of the vermilion border, and loss of boots, and finally thinner of the flat lips. Okay, this is very important topic. Why? Because I think this is can get you a patient in your office. The patient didn't hate dentistry. The patient liked to sit in your dental chair. Okay, lips is very, very important to give indicator for it, and I think it's our gate when we work in aesthetic dentistry. This is the first lipstick made by the ancient Egyptians. Let's revise, have a very rapid revise for the anatomy. This is a philtrum, and this is a Cupid's bow, and this is the oral commissures. Okay, oral commissure is very, very important. This is lip vermilion, philtrum, oral commissures, and this is mucogingival or mucocutaneous junctions. We call this wet line. Let's see this video. This lady, she had a very thin lip. She smiled. We discuss her smile later, the type of her smile. Actually, don't do this bad veneers, it's not me. This is after I do lip fillers for her to restore the smile. I put some hyaluronic acid on this lip, and I get this for it. I like to photograph my patient in videos. Why? This is very important. Why? Because I am treating a dynamic patient. We are not treating a patient. It's very important. We are treating dynamic patient, not static patients. Okay, let's see this patient. And very important things, that's in this area I am going to restore the patient fats or the patient soft tissue. So I like to put my fillers, and this is very crucial. I put my fillers above the muscle, not below the muscle. This is very important. This is after I put the fillers. I get this result. I like to see the patient smiling and patient speak. This is very important to avoid any unnatural results. So this is before and after. And also I like to take for my patient before I start, I like to call what I call it video consent. I discuss with my patient. I like to photograph the case, and I told my patient I'm going to photograph it, and she agreed for public publishing. This is very important and can save you. This is this lady with thin lip. We call this reversed smile. We'll speak later on about these details. And this is the final result, immediate. This is before and after. So the concept, you have to reconstruct the natural anatomy in a static way. This is exactly what I'm going to do in this part of my lectures. Okay, I like to put my fillers above the muscle, and it's called dermal filler, not mucosal filler, so it's better to inject it in the dermis. This is before and after. This is the key. Also, you can camouflage a maxillary retrognathia using some fillers. This is the beauty of the filler. You can create this beautiful lazy M and the Cupid's bow. Okay, we have some secrets to create a painless injection for my patient. I prefer to use different needles. Why? This is, if you see, this is a version needle. If you are injecting once, our needle will become bent or extremely bent like this. So it will be very painful when you're injecting to your patients. Okay, this is exactly the fate of the fillers. Before, it will last 6 months. And after 6 months, I like to something boosting for my patient. This is enabling me to not let the patient till it completely sunk and completely lost it. Let's speak about this smile story. I worked this case with my friend Dr. Muhammad Abdullah in Alexandria. This lady, she's not happy about her smile. He make digital smile design for her, and he make this planning, doing this excellent veneers. I do for him laser management, and after this I'm injecting in this Marionette Line. I'm injecting the nasolabial fold. I'm going in the other side. I prefer to start and finish the left side first, then I go for the right side. Also, it's very important regarding the material management. If you like to finish the face with using one vial, so you have to make a material management. You finish the face using the left one, then you start with the half of the carbol, then you start with the other half. I put in the lip, I increase it slightly. And also I make lip definition. So this is called lip, it's called dermal filler, not mucosal filler. So the most crucial things is to puncture using in the mucocutaneous. This is very, very important. It's called dermal filler, not a mucosal filler. Also, I have to do the lower lip also. In all cases, you have to do the lower lip. Why? To make the balance between the upper and lower lip. This is after. Let the patient smile like this. Very beautiful smile. And this is the end of our work. As you see, this shows the difference between male and female in our cultures, in our Egyptian culture. Why this person looks sad? Because he have these crowns, this BFM. He has congenital missing upper lateral incisors. So we remove this bridge, inserting 2 dental implants, and my friend Dr. Muhammad make these temporary crowns. He make a planning. I put these dental implants, and they make the same planning. Okay, this is after. Patient after, also the patient has slightly thin lip, and this chin, it's slightly curved. This give a long face profile for the patient. We make slight camouflage instead of making orthodontic surgery. This is just camouflaging for the patient, and then the chin to get the strong chin. This is after he finish the crowns. And this is the end of this smile story. Okay, now we start with another something very recent, and this is the future. This perfect photography is done by my friend Dr. Muhammad Isam. He do this photography for that patient. This patient take Ramactan as an anti-acne treatment, and after he finish, he has post-acne scar. He's not happy about his very deep nasolabial folds. We do, this is the future. This is exactly what we do it now. Nowadays we do something very recent. This is done by my friend Dr. Amr Tuhami. He do a digital, he do using a Prophase and uses this software with Comb Beam. We make a plan together for this our treatment, and we design something that's like a mask that helps us dramatically and evidence-based when we to inject our fillers. He do this. He make this Comb Beam CT scan and using a Prophase, and then he connected this Prophase on the Comb Beam CT scan. Also, we can use this software to make a proper analysis for the face and enabling us for 3D planning. This is one of the recent technology. It helps us to provide the patient with most recent and most evidence-based treatment for the patients. Also, we can see the soft tissue profile, and we can check the muscle for the patients before we do it. We can connect the two, smiling and non-smiling for the patient. And after we measure the exact amount of the fillers and the exact plan for injections, after we finish this exactly for the patient, we can design and we can print a facial mask including the gauge depths to help us during our work. See, by using this technology, we can see the exact depths and the exact plan we put our implants. We can measure it exactly up to 0.0 millimeters. So this provides us with highly evidence-based during our work. After we finish this planning, it's extremely easy to do our work. And this is after we able to restore the nasolabial fold and to make our patient happy after the finish. But please don't be like this and buy patient, buy more and more by the market. Okay, I think not only the size but the color is very important. In the first I speak about the colors. I speak about the size. Now this case it's done by my friend Dr. Muhammad Adib. He changed the color of the gum, to the pink, and this is give the patient very good illusions. Okay, this I think not all with the gold. In the past, before laser, we do this technique, cutting the gum. I think this is very unhuman. When I do this technique, I was so proud about this technique. Do you think laser is mandatory in that technique? I think so. Why? Because I'm using this in these techniques, I'm using diode laser. So my chromophore here is melanin pigments. So I am targeting melanin. So I don't burn the gum or the lips. So this is my target. Before I start, I like to do initiations. And to start to work in the epithelium, and you didn't get any burn to the patient. This is enhancing very patient safety concept to our patients. Okay, this is regarding to the gum. It's not our scope today. Today I'm going to work with something slightly recent technology. It's called lip depigmentation. To best of my knowledge, this is the only published English literature in this issue using this diode laser for lip depigmentation. This is exactly what happened in depigmentation. In the lip, we have these pigments. So I'm targeting my laser. This enabling me to get a beautiful pink color of the lips. This exactly I'm going to do it. I aiming my laser and I follow the Langer's line or wrestling line. I just speak in the beginning of my lectures. So I put my laser, my diode laser. I like to use large fiber, 600 micrometer. Okay, let's see this case before we start. Till now I have 12 cases in this technique. And this article, it's published in Smile Dental Journal. If you like to download it, it's free now. This is I prefer to start with low level laser. Then I start depigmentation. This is the full technique, my technique. I published this technique with my friend Dr. Muhammad Adib. This my technique in lip depigmentation. I start with low level laser. This enabling to decrease the pain, post-op pain for the patient. And now I go in the lips. You have to take care during your work not to burn more from the lip. Just aiming to the pigment, and your motion you are following now. By your motion you are following the Langer's line. During this I make saline irrigation to reduce the patient pain and more comfort. And actually it's very, very important. This is the most annoying element at that technique is the smell. So it's better to make a proper irrigation, and during your work you make an irrigations, and always try to clean your fibers. Why? Because if your fiber is full with dirt, maybe this dirt can be re-implemented again in the tissue and make a more pigmentation. So see, now it's become more pink without any bleeding. But the problem in this technique has two defects. Number one, the patient has what we call it social lag. The patient has edema post-op. It will last for 2 to 3 days, and also after you finish there are a relapse after 1 year. So the patient needs to repeat the procedure after 1 year. This is immediate post-op, and there are completely color matching between the upper and lower now. What's red flag? Not to do it if you have this. If you have a patient with angular cheilitis, not advised to do this technique for him. Or patient with recurrent herpes labialis, patient with recurrent herpes labialis, or patient with abscess, patient with mucocele, it's not advised, or actinic cholosis, not advised to do it for him. Okay, do you think laser is mandatory in this technique? For me, I think yes. Okay, another technique before we finish our static way. This what we call it BDO. This is enabling to decrease the lip size instead of doing surgery. It's called Bda threads. We put these threads to decrease the oral commissures. This will decrease the lip size for the patients. We're going to the upper lip first, then we start the lower lip. I prefer to finish side by side. I prefer to start with the left side, then I do the right side. Okay, now we speak about this technique, laser surfacing technique. We have two techniques. Techniques can be ablative, that's mean I remove something, and non-ablative. Non-ablative, it's mean I use my laser for stretching. This is my, I do this case. I use the diode laser in very high power, in chopped mode, in non-contact. This enabling facial, intraoral facial rejuvenations and lip tightening for the patients. This technique, it's 10 minutes and enabling very tight stretching to the patient lips. This is non-contact mode. Why? Because of that, if the temperature become high for the patient, if this temperature become high for the patient, or there are some heat for the patient, this may be burn the collagen for the patient, so it become risky for the patients. Very important when you work, you have to communicate well with the patient and make it slightly less good relation with the patient and make slightly painful for the patient. This is done without anesthesia. This is enabling proper stretching for the patient collagens. Okay. Now I speak about the dynamic, the static element for the lips. Now I'm going to speak about this another issue. I speak about the dynamics. I go to this part for my friend Dr. Muhammad Al-Gammal. The smile has a very important rule. What's mean a smile? Smile is your lip moved. It's mean that your lip is moved. This is what we call it smile. Okay, in a smile we have three important elements: teeth, gingival scaffold, and lip framework. So I think if you like to treat a gummy smile, you have to know exactly what's happened in gummy smile. Gummy smile, it's mean that your lip, the curtains, it shows something, the teeth, and another something, it's what we call it, the gingival scaffold. Smile has a different levels starting from the oral, from the facial aesthetics, and nowadays we reach what we call its microdentistry. It's a small reach using microscope. Smile lines should be parallel to the lower lip, like this line. See this lower lip line? This smile line. We have different types of smile according to the smile line. Type 1, we call this attractive or sexy smile, like this smile. Another things we call sophisticated smile or a straight curve smile. And I think this is what we call sporty smile. This is mixture between sexy and sophisticated smile. Negative smile. And finally we have a gull-shaped smiles. Mona Lisa smile, like this smile. All this smile is between the lips, teeth, and gum. So if you like to design a smile, you must not forget the lips. This is very, very important, very crucial things. A cuspid smile, it's 1/3 of the people. It's a particular muscles, levator labial superioris. It's dominant. If you have this muscle, it's called levator labial superioris. This dominant in this cuspid. Full denture smile, it's like denture, it's very rare. Commissural or commissural smile, this line passing between the oral commissures, like this smiles. Smile, it can be social or enjoyment. So you have, when you make a design for the smile, we can social smile, not an enjoyment smile. Boosted smile, it's voluntary, static, okay, and it's reproducible, and this is enabling you to build a smile design. Unboosted, it's involuntary and it's dynamic, and it's difficult to work on this smile. Gingival display, this is normal gingival display. Its average smile line is 75 to 100 of the tooth displayed. Other it's called high smile line. Before you work in gummy smile, you have to diagnose it. I present this before in Pakistan and in Kuwait. I like this person. This person, his name is Hippocrates of course. When we finish our medical school, we told his oath, it's a primum nocere, first do no harm. So please, before you treat a gummy smile, you have to focus in patient safety. What's mean patient safety? It's first do no harm, right patient and right diagnosis, right treatment plan, and finally perform the right treatments. We study all these cases. Gummy smile, it's what we call it high smile line, it's gingival line display, it's maxillary excessive exposure of the maxillary gingiva during smiling. All these cases, 7% of the young males they have a gummy smile, and 14% of the young female they have it, and about the 1/4 of the patient asking for orthodontic treatment they have a gummy smile. Before we start to treat a gummy smile, we have to know the length of the lip. The length of the lip in male, measuring from subnasal to the wet line, it's from 22 to 24 millimeters, and in female from 20 to 22. And we have to measure also a very important things. We have to measure the upper central incisor. The incisal show in the female, it's from 3 to 4 millimeters. In male, it's just 2 millimeters. See this smile, it's gummy smile. These different smile types according to the smile line. This algorithm is very, very important. I like this algorithm. It's published by Goldstein. It shows the excessive gingival teeth display. It can be either increased incisor show during rest. You have to measure the lip. If the lip is short, it's a case of short lip. Can we use a Botox in that case? Yes. But Botox, it can be camouflage. If lip is normal, we have to put something, a mirror in the occlusal plane. If you find harmonious, it can be a case of VME. It's mean vertical maxillary excess. So the patient's candidate for orthodontic surgery. Can we use a neurotoxins or Botox in that case? Yes, but can be a camouflage, not a treatment. Difference between interior and posterior teeth, it can be incisor over eruption, so it will not be a case of Botox. It has no value. This case, an orthodontic case. If you have normal incisor during rest, when the patient smile, you show its movement, you have to measure the clinical crown. I measure the clinical crown of the lips here. If the clinical crown is short, if no is not normal, this means that's the case of hyperactive lip. I have the muscle is very active. So I can, in that case, I can use a Botox for a treatments. If I have a short clinical crown, I have to see if I have no attrition or attrition. If I have attrition, it can be incisor over eruption. If I have no attrition, I have to, maybe it can a case of gingival hyperplasia or altered passive eruption. It's very important to make a diagnosis before you start to treat a case and measure the lips. And I like to use videos before I make diagnosis. Like this case, I did it yesterday. This lady, she smiled, she had a gummy smile. I measured the lip it's normal. So, that case, I would do for her, she had gingival hyperplasia. What I do for her, well, this is my plan. This cartoon would show us how I use laser for that lady. I use Shao marker before I work. This helping me for determining the zenith point before I work, to do a proper gingival contouring for that lady. This is a clinical scenario. I use diode laser, 2 watt in chopped mode, and this is after doing. Okay, also we can use an erbium laser in that case, and also this erbium laser enabling us to do in some cases crown lengthening, osseous crown lengthening. This is another case. I do gingivectomy, and my friend Dr. Muhammad Shams do this excellent veneers. Another modality, if you have hyperactive lip, we can use some material to relax the muscle of the smile. Which is the most important muscle in the smile? We have zygomatic major muscle. This is called smiling muscle. So this muscle is very, very important. And we have levator labii superioris, and this depressor septi nasal. So we can inject in that muscle. This is another case. In that case, I make gingivectomy, and my friend Dr. Muhammad Shams make these veneers. Another case, I make lip switching for that case. I prefer to use laser to create a scar, diode laser, then I make continuous locked sutures. This is after 1 year. Another case, also done by veneers, but I think old is gold. Orthognathic surgery remained the golden standard for vertical maxillary excess. And this is orthognathic surgery, this is after. Botox, I think, remained the golden standard for the hyperactive lip. I inject 2 points per site. Inject most probably in 3 points in the smiling muscle. Okay, when you inject, you have to take care not to inject in orbicularis oris. Why? If you inject in this muscle, the patient exhibit a very annoying period of the patient cannot eat or cannot smoke or cannot speak. There are some article, it's called Yancey point. Yancey point, he inject 1 point distal to the ala and 3 centimeters above the oral commissures. For me, I prefer to inject in several points, like this lady. I inject for her, and this is after. A lot of cases, it's very easy, and the patient responds dramatically. Gummy smile is very important to get a correct diagnosis. It's very important, very crucial to help our patients. Okay, this is a list of secrets. You have to measure the length of the lip before you start. You have to check the inside of the jaw, dependent video. Take care of the depressor septi. Nasal shape is very important. So I have to take care of levator labii ala nasal muscle. I have to check the site of the injection. If I do a lip switching, I prefer to do a scar creation using laser. Orthodontic only in growing patients. Okay, what's recent and what's the future? The future is that we can design a mask. It's enabling us very accurate injection. I make this case with my help of Dr. Amr, my friend Dr. Amr Tuhami, to do the same using a prophase system. And also, he get resting appearance for the patient, and he use this prophase on cone beam by superimposition. Now he is putting this prophase on the cone beam CT scan. He check the soft tissue from the cone beam to see the place and the attachment for the muscles here. And after this, we select another smiling face for the patient. We try to get the smiling face. So this will be very important to make a mask before you work. and using mask you can determine the exact point of the injections to enabling the easy treatment for that patients. So he get these photos, and after he finish, he print a mask, and this is enabling me of doing the proper work. Okay. Thank you for attending. If you have any questions, I'd be more than happy to answer you. Thank you for your attendance. Thank you, Dr. Mazen, for your kind invitation and for your support.